I'm Dr. Lana Nelson. Thanks for joining me today. We're going to be discussing treatment options for heartburn, also known as gastroesophageal reflux disease. We're going to take some time to discuss a new procedure as well called the esophax or TIF procedure, which is a new type of surgery that's done completely without incisions that can correct or treat heartburn. Now, gastroesophageal reflux disease comes in a broad variety of presentations. The most common thing is typical heartburn or reflux, and when we talk about heartburn, what this means is burning in the chest. It frequently comes after meals. Sometimes it can come in the middle of the night as well. Other symptoms may exist. Some people experience things such as regurgitation, which means food comes back up into their throat and sometimes into the back of the mouth. Some people experience a sour acid taste in the mouth. Outside of the digestive complaints, there are also other complaints that people may have associated with reflux. It may cause voice problems, chronic cough, bad breath, and breathing problems as well, including worsening of asthma and worsening of bronchitis, as well as aspiration pneumonia. What causes GERD? GERD is caused simply by a dysfunctional valve that exists between the esophagus and the stomach. First, let's take a look at a normal or properly functioning valve. Typically, the esophagus passes through the chest cavity and enters the abdominal cavity before it meets up with the stomach. As it passes through the diaphragm muscle, which is the muscle that separates the chest from the abdominal cavity, there's an angle that's created between the esophagus and the stomach, and at this angle there's a small valve or a flap valve. Sometimes this valve is rendered dysfunctional. The most common time that this is rendered dysfunctional is with the existence of a hiatal hernia. A hiatal hernia is a small defect in the diaphragm which allows the upper stomach to prolapse into the chest. Whenever the upper stomach moves into the chest, this allows reflux of contents from the stomach up into the esophagus, and that can cause a burning sensation as well as the other symptoms that we've just described. Some of the side effects or possible impacts of reflux include things such as esophagitis, which is inflammation in the lining of the esophagus. There's also something called Barrett's esophagus, and Barrett's esophagus is potentially a precancerous condition which causes changes in the cells that line the esophagus. Over time, some of these cells may transform into esophageal cancer. It's something that requires ongoing monitoring. There may also be problems with stricture or scar tissue that develops at the lower portion of the esophagus. Some individuals experience difficulty swallowing from the inflammation and scarring. And esophageal cancer is also associated with gastroesophageal reflux. Now, how does your physician diagnose reflux? The most common way that reflux is diagnosed is with a history and physical exam done by your primary care provider or your gastroenterologist. Simply by asking a few questions, the provider can determine whether or not your symptoms are related to heartburn or acid reflux. It is then common for you to receive a prescription for medications to address the reflux or heartburn, and your response to these medications may indicate whether or not your symptoms are truly related to heartburn. Failure to respond to medications may indicate that your symptoms are from another cause. There are some diagnostic tests which can be done to evaluate for heartburn or reflux. The most common one is something called endoscopy. An endoscopy is a procedure which is done under sedation. A camera is passed through the mouth into the esophagus, and the entire lining of the esophagus as well as the lining of the stomach can be inspected with visualization. Sometimes biopsies are taken as well, and the anatomy can be inspected for a hernia. Another way to diagnose reflux is with something called pH testing. pH testing refers to placing a probe in the lower portion of the esophagus, and this measures acid exposure in the esophagus. That probe is attached to the lower esophagus, and it transmits a signal to a small pager or a transmitter, which is worn around by the patient for approximately 2 days. The probe eventually will pass through the system and does not have to be retrieved with another procedure. Something else that can be done is a test which is done called an upper GI. This is an x-ray exam which is done with live images, and the patient will drink contrast, typically something called barium, which is illuminated on the images, and the radiologist will follow the progression of the contrast through the esophagus and stomach, and this can highlight any abnormalities in the anatomy as well. The final test, which is sometimes utilized to diagnose reflux, is something called manometry, and manometry is a test of pressure, and a probe is placed through the esophagus up into the upper portion of the stomach, and this records pressure measurements with swallowing, and also a pressure differential between the chest and the abdominal cavity, which can indicate whether or not the valve is functional. So what are the treatment options for reflux? The most common treatment is lifestyle modification, and this is considered a first line of therapy for people who have heartburn or reflux. Certain things that individuals can do include things such as laying down after a large meal. If this can be avoided, then that will lessen reflux symptoms. It's best to have an empty stomach before you lay down in the evening. It's also best to avoid large meals. Large meals can over-distend the stomach and cause contents to reflux back into the esophagus. Weight loss is recommended for individuals who are overweight because increased weight increases the pressure in the abdominal cavity, and that in turn can contribute to reflux. And then there are certain irritants which can cause reflux as well. The most common ones that are known include caffeine, alcohol, chocolate, fatty foods, spicy foods, and tobacco. Medical therapy is the second line of treatment for heartburn, and there are multiple medications which are available. Some of these medications are available over the counter without a prescription, and other prescription medications are available as well. Some of the most common ones include things such as Zantac or Pepcid. These are commonly available over the counter. And then there are some prescription medications which are considered to be a little bit stronger, things such as Nexium or Dexilant, and you may be familiar with many of these if you've suffered from heartburn. There are also medications which are considered motility agents, and these motility agents are meant to promote emptying from your stomach, and the concept is that if your stomach is empty, then there will be less reflux or acid exposure in the lower esophagus. There are also topical medications which act to coat the esophagus to protect it from the acid. And then, of course, there are natural remedies that have been tried over the years as well. The most common one that I hear about is something called apple cider vinegar. It's been said that a cup of apple cider vinegar a day can help reduce heartburn symptoms. However, there's no data to support this. The advantages of medical therapy include the fact that it's non-invasive. There are multiple treatment options, so if one medication is not effective or stops being effective, then there are other alternatives. It is also considered safe and relatively effective. Some of the disadvantages of medical therapy include that it does not do anything to correct the valve. All of the therapies are directed at reducing acid content in the stomach or acid exposure in the lower part of the esophagus, but it does nothing to recreate the valve, which is the underlying problem that contributes to heartburn. Some people do experience breakthrough symptoms while they're on medications. Perhaps if they have to take them twice a day, the medication may not last the entire 12 hours, so they find themselves needing medication sooner, and unfortunately the medications can only be given on a certain schedule. There's also been some concern recently about the increased incidence of hip fracture and osteoporosis in older individuals who are on long-term proton pump therapy, and this is due to the interference of absorption of certain nutrients in the stomach. The stomach acid is decreased by these medications, so it alters the environment and therefore can interfere with absorption of certain nutrients. Because of the alteration of the acidic environment in the stomach, this may also cause some drug interactions. There is thought to be an increased infection risk for certain types of infection, including pneumonia and a type of colitis or inflammation of the colon called C. diff. Some of the other treatment options include surgical therapies, and we're going to talk about different types of surgical therapy. We're going to first talk about traditional surgical therapy, and then we're going to talk about newer endoscopic therapies. Traditional surgery is done either through an open incision in the abdominal wall or done laparoscopically, which means with tiny incisions through the abdominal wall. The most common type of surgery done for reflux is a procedure called a Nissen fundoplication. And Nissen refers to the surgeon who developed the procedure. Fundoplication refers to the type of procedure which involves wrapping the upper part of the stomach around the lower esophagus and upper stomach to recreate a valve. The hernia is also addressed in this type of procedure. The first thing that the surgeon does is divides the attachments around the esophagus and the stomach that attach these structures to the diaphragm. The stomach is then brought down into the abdominal cavity, and the lower esophagus is brought into the abdominal cavity as well. The diaphragm muscle is then closed or reapproximated around the esophagus. This is the hernia repair. And then the upper portion of the stomach is wrapped around the lower esophagus and sutured in place, creating a valve. The first thing that the surgeon does is divides the attachments around the esophagus and the stomach that attach these structures to the diaphragm. The stomach is then brought down into the abdominal cavity, and the lower esophagus is brought into the abdominal cavity as well. The diaphragm muscle is then closed or reapproximated around the esophagus. This is the hernia repair. And then the upper portion of the stomach is wrapped around the lower esophagus and sutured in place, creating a valve. The advantages of surgical therapy are that it's highly effective. You can eliminate medication use and symptoms in up to 90% of individuals. It is considered to be a durable therapy as well. The results are long-lasting, and it corrects the anatomy by repairing the hernia and making a new valve. Some of the disadvantages of surgical therapy are that it is invasive. There is a possibility of recurrence, meaning that the surgery fails. This happens in about 10% of individuals. And there can be some side effects from the newly created valve as well. The most common side effects are gas bloat, which simply refers to increased gas in the lower abdomen. Some individuals have difficulty swallowing once they have a new valve, and this is most common in the weeks after surgery as that new valve is healing and as there's some swelling that needs to resolve. Also, individuals who have had a fundoplication are likely unable to vomit.